This season of This Headache Journey is sponsored by gammaCore non-invasive vagus nerve stimulator, the drug-free solution for migraine and cluster headache. gammaCore is the first and only FDA-cleared non-invasive device to treat and prevent multiple types of headache pain via the vagus nerve. It's small, handheld, and portable for quick and easy treatments whenever and wherever needed. gammaCore is safe, effective, and easy to use. Learn more at gammacore.com. That's GAMMA core.com. Hi, I'm Adam Flaherty, and welcome back to This Headache Journey. I'm so glad you're here listening. In this podcast, I revisit many of the interventions and modalities that I've tried over the years in an attempt to reduce my chronic daily headaches so that you can benefit from firsthand information on why that intervention works for many people like us. I want to be very clear that I am not a doctor, and nothing you hear in this podcast constitutes medical advice in any way. But if the modality or intervention that I'm sharing about sparks your curiosity, maybe it's something you can bring to your own PCP, neurologist, or headache expert to discuss whether it could be a fit for you. In today's episode, I'm going to share about my experience receiving Botox injections for my daily tension headaches. And a bit later in the episode, I interview Brooke Phenicie, a nurse practitioner who administers Botox regularly for her patients at her clinic outside of Chicago. But first, I'll do that very podcasty thing of asking you to please consider subscribing to This Headache Journey wherever you're listening. That might be Apple Podcasts, Spotify, Amazon Music, Overcast, Pocket Casts, Castbox, Hark Audio, or somewhere else. And of course, a review would be awesome, but even more importantly, picture someone you know who also suffers from chronic headaches or migraine, and text this episode to them. I'd love to think that my own experience could be the very thing that changes someone else's life in a meaningful way. Botox injections have been used cosmetically for decades now. People inject small amounts of toxin into their foreheads, eyebrows, cheeks, lips, and more to reduce what they perceive as imperfections or to modify their look in a way that makes them feel more comfortable, confident, or attractive. I'll leave it to my guest to share the history of how we started adopting it for medical uses, but my first experience with it was somewhere around 2012 or so. I only had one session back then, but I revisited Botox more recently just a few years ago and had 3 sessions which I recall much more clearly. Now, I've experienced plenty of needles in the past related to my headaches, from self-administered anti-CGRP drugs to infusions to a needle in the occipital nerve at the base of my skull, and while it's not my favorite thing, the idea of 2 or 3 dozen quick injections wasn't terribly intimidating to me. My procedures happened in a standard medical office, and the doctor who performed the procedure worked quickly, injecting small amounts of Botox across the top of my forehead, various predetermined spots around my scalp, and in my trapezius muscles. Some of them were barely noticeable, and some of them stung quite a bit. I liked that the doctor worked fast, and several times during the session, I'd let him know that I needed to take a breather. Even without a fear of needles, I found myself breathing deeply and intentionally for the duration of the injections. Beyond any discomfort, it's also just a weird sensation. You can often hear and feel the fluid being injected. It's like one of those internal noises, if you know what I mean by that. After the procedure, I recuperated for a few minutes and went on with my day. The only visible indication that I'd had this done was a bit of redness and maybe tiny red spots at the injection sites on my face, but that faded away very quickly. My head was a bit tender for the remainder of the day, so I'd want to be careful not to press it hard against the headrest of my car, for example. I had 3 sessions, roughly 12 weeks apart. I don't have a headache journal from that time, but what I remember is feeling that it could have improved my headache frequency a bit, but not enough to warrant continuing to receive it after those initial 3 sessions. But The purpose of this podcast is to give you more tools in your tool belt. So just because something that I've tried wasn't the magical unicorn that fixed me, that doesn't mean that it couldn't be a game changer for you. With that said, I'd like you to meet Brooke, who can speak far more eloquently than I can about why Botox can be so effective for headache and migraine sufferers.
So my name is Brooke Phenicie, and I am a full practice nurse practitioner. I just opened my own clinic called Renew Migraine and Wellness Center in Glenview, Illinois. It's just north of Chicago. And I'm excited to set out on this adventure and, hopefully find more patients that I can help out with.
And I have to assume that opening a headache migraine wellness center must have been inspired by your own headache journey. Is that true?
Yes, absolutely. So I began myself having headaches and migraines in my early 20s, and they've just kind of progressed in frequency and intensity, depending on life situations and hormones. And, I've had 3 children now. And so yes, I feel like that's become a passion of mine. I stumbled upon treating headaches and migraines, really. I had a great opportunity with a local neurologist, Larry Robbins, at the Robbins Headache Clinic. And we had just a great professional relationship. And so, I really have developed a passion for it.
That's wonderful. So I've invited you here to chat about Botox and using Botox injections as a treatment for migraine. I wonder if you could educate our listeners a little bit about the history of Botox as a tool for migraine relief.
Yes, it's a very interesting story. So they began using it in the 1980s, actually, to help with blepharospasms, which is like this eyelid twitching. So it was discovered then. That's when it got its first FDA indication. And then in the 80s and 90s, we started using it cosmetically for those wrinkles. And patients were discovering that, hey, I don't have as many headaches and migraines. And so word got around, and they did further testing and actually got it FDA approved in 2010. And it's been approved since then for chronic migraines. Chronic migraines is somebody who has 15 or more days per month of headaches and migraines, 8 of which have to be actual migraines. And patients ask me, well, what's the difference between a headache and a migraine? So I always tell patients migraines are more moderate to severe in intensity. You oftentimes have either some nausea or some sensitivity to light or sound. And so of those 15 days a month, at least 8 of those days have to qualify as a migraine. And the pain has to last at least 4 hours per day, or per attack, I should say, and going on for the last 3 months at least. And insurance has gotten better over the years with covering it. I would say most insurance companies, you need to at least try and fail 1 preventative, maybe 2 preventative therapies, whether that's antidepressant, whether that's an anti-seizure or a blood pressure medication or an anti-CGRP class of medication. So most patients can get it covered, but you might have to try and fail some other medications first.
It's interesting you mentioned that it was people who were getting Botox for cosmetic purposes that were noticing that it was helping with their migraines. So I'm assuming when people are using Botox for cosmetics, it's typically in their face, right? All areas of their face. And so when we're thinking about Botox for migraine, that is all over the head and into the neck. So how is it the case that injections in the face were actually causing relief for migraines?
So, typical cosmetic injections would be like lower and upper forehead and around your eyes. And we have a lot of muscles and nerve endings and blood vessels in that area. And so it impacts the nerve pathways. And so going back to what is a migraine? It's this very hypersensitive brain. There's this wave of electrical processes that has this cascade of events impacting certain nerve pathways. And so Botox goes in and calms down those sensory nerves. That's how I kind of like to explain it, blocking some of the neurochemical releases and decreasing some inflammation and kind of trying to hopefully stop that cascade of events, creating the actual migraine pain.
So when there is a good candidate, you are preparing them for this procedure. What kinds of things do you tell them? What do you sort of walk through verbally before you start making the injections.
Yeah, yeah. So I always explain to them, because when they hear about Botox, they're like, "Well, isn't that the cosmetic thing?" And it is. Yes, it is. It's the same tiny purified protein. It's a teeny, teeny, teeny amount, but it's purified and it's FDA approved. There's many medical different indications for it. And so migraine just happens to be one of them. And I think that assures patients when they find out that Botox is not just for cosmetic, but it's also for all these other medical conditions. And that makes them feel better, usually. This is a migraine preventative therapy. We inject it every 12 weeks. And the reason why we do it every 12 weeks is because it wears off about that 10 to 12 week mark. So in order to catch the migraines before they start coming back again, hopefully we can keep the preventative therapy going.
You begin the treatment, and roughly how many injections are you doing? And talk to me about the theory behind where they're being injected.
Yes, yeah. So there's 31 injection sites, which I know can sound very intimidating, but I also like to pitch it as 7 different areas. So we've got about 3 shots here on the lower forehead and those muscles, 4 in the upper part of the forehead, 4 on each side of the temple, so 8 total. 3 in the back of their head, 2 on each side of the upper neck, and then 3 in the trapezius muscles. The procedure itself, I would say, only takes about 3 to 5 minutes to do the actual injections. Very tiny little pokes. I tell some patients sometimes you don't even notice the poke, especially in certain muscles. You may not feel it as much. And then some might feel a little bit more sensitive, especially like the forehead where we have a little bit more nerve endings. But for the most part, I would say most patients say it doesn't hurt too terribly bad. They would definitely take this over having a migraine. And the fact that we only do it every 12 weeks helps also, for them to feel more comfortable in getting this done. It's just tiny little pokes. We use an insulin syringe needle. And so it's a very fine, thin little needle. And so I think that helps reduce the pain also.
Yeah, I'm sure most people listening would agree that, and probably have put up with a lot of things that are uncomfortable in the various things that they've tried. And unless you're deathly afraid of needles, are you willing to put up with some moderate discomfort once every 3 months if it's the thing that really helps? And I would imagine that most people would be willing to do that.
Absolutely. And one thing I need to cover too is, as headache providers, how did we come up with these locations? And so a lot of this follows the different nerve pathways. And so it was highly, highly studied. Many different protocols were studied. And this was the PREEMPT trial, showed us exactly where we need to be injecting based on the typical anatomy of where these nerve pathways are.
My headaches are always accompanied by neck tension, and I haven't been able to determine whether it's the headache that causes the neck pain or the neck pain that causes the headache. But I wonder if Botox can be used in ways outside of the PREEMPT protocol. For example, can you use it in the neck?
Absolutely. And I'm glad you brought that up. So I'm actually also trained in Botox for cervical dystonia. And so I've seen a little bit of a crossover, a gray zone with that, where some patients actually have cervical dystonia, which, whether it's causing their headaches or migraines or impacting it, of course. When we do the Botox injections for cervical dystonia and we're following that protocol, I actually have had some patients who maybe the migraine Botox protocol didn't quite work as well, but actually doing the cervical dystonia injections actually helped them so much with their neck muscle spasms that it actually did help with their headaches and migraines, which has been really exciting. So I've been injecting patients for over 14 years, learned about cervical dystonia injections about 1.5 years ago, started implementing them with some of my patients that I've identified. And some of those patients have had life-changing results, even from the cervical dystonia Botox injections with their headaches and migraines and neck pain.
Can you give me a quick definition of what cervical dystonia is?
Yeah, I kind of explained to it's a very tight neck muscle spasm. And so sometimes you'll notice patients when they have their head tilted a little bit, or they'll have one little shoulder pull in here. And so if we can relax those muscles with the Botox and help calm down some of those nerve pathways from firing and kind of correct that posture, patients definitely have significant improvement. It's been life-changing for a lot of patients.
So a lot of people hear, needles, injections, and they start thinking about what are potential side effects. Are there any short-term or long-term side effects that you have commonly seen with your patients?
I would say short term, some patients feel obviously a little pain from the injection site. You might bruise a little bit. So you can apply ice if you feel that. The neck pain, that like tension from where we injected might only last a day or two. Sometimes patients will get a headache that evening, whether they were going to get one or not because they're chronic migraineurs, we're not really sure. But some patients, the stress of getting an injection can create a migraine. But no, in general, it's really, really, really well tolerated. Of course, there's little side effects that could occur, but thankfully they're transient. They go away usually after a couple of weeks. It doesn't get absorbed systemically. So it stays right where I inject it. And so it's not anything that's going to irritate your stomach or your liver or interact with some of your medications. So it's something that's very safe to use. It's not FDA approved for women who are pregnant. However, clinically, a lot of us headache providers throughout the country are still using that off-label to help prevent headaches and migraines from occurring for patients that are pregnant or nursing. And same with under age of 18. It's not FDA approved either for under 18. However, we've been using it long enough and have done some post-FDA approval studying and research, and it looks extremely safe, which is really exciting.
I'll say just from my own experience in terms of side effects, I don't even know if you would call this a side effect, and I'm sure it was from the injections that were in my upper forehead along, I guess, my hairline, is that the one thing that I noticed is that my forehead wrinkles were very smooth for a period of time after, which wasn't a problem for me.
Yeah, that's definitely a welcomed side effect for sure. Most patients are loving that. It cracks me up because I have some teenagers that will be like, why don't anybody know that I got Botox? And then, I'll look at the mom or the dad and they'll be like, oh, are you kidding me? We love to have Botox and no wrinkles. Yeah. So no, it is a nice, pleasant side effect.
So what kind of success rate have you seen from patients who have come to you with migraine and have been treated with Botox?
So I love explaining this to patients because they'll ask me, what can I expect? So for the first session, I tell them I'm looking for any type of benefit, whether that's a decrease in frequency of your migraines, a decrease in the intensity level, maybe the duration's shorter, maybe your medications work better, or you have less sensitivity to light, sound, or nausea. So those are great benefits. Now, I would say in general, 50 to 65% of my patients get something pretty quickly that first session. If not, I encourage them to come back for that second and third session. We do 12 weeks, and 12 weeks before we completely give up on it. But I would say at least 50% of patients get 50% or more improvement. And there's actually 25% patients will get actually over 75% improvement. And I have had a handful of patients in my practice get 100% improvement and eventually not even need Botox, which is life-changing. Absolutely. But I'm very realistic with my expectations with my patients. I don't want them to get discouraged and first session come in and be like, it didn't work, And so in another thing that's important too is because it lasts for 12 weeks, it kind of wears off that last week or two for some patients, and they might come back in and say, oh, my headaches have been horrible. All right, let's rewind back. What did it look like month 1 or 2, 6 weeks in? And so let's get that diary back out. Oh, well, I guess I wasn't having as many headaches and migraines. So we have to kind of remind our patients and reflect of, okay, this is where you came from. What did it look like about halfway through? And then where you're at now. And some patients actually welcome that wear off effect because it kind of reminds them like, oh, this was working. This is working. I forgot how bad it used to be. So some patients don't quite realize or remember how bad it used to be, but it's life-changing for a lot of my patients.
And you mentioned it's a very low risk. However, I wonder for somebody who is using it long term, so every 12 weeks for a number of years, because it's the thing that keeps their pain at bay, have you found there to be any risk in using it long term over the course of years? Does the toxin sort of build up in your system, or does your body sort of break it down, or how does that work?
Yeah, it breaks it down. It gets rid of it after 3 months. So no, there's no long-term side effects that we've noticed. There is some thought for some patients, they might, because we're relaxing those muscles so much, that sometimes you can get some what we call muscle wasting, but it's pretty rare. And if that is occurring, if you like you've gotten more muscle weakness in that area over time, we can take a break. We can take a break from that exact location and spot. But no, in general, we have over 5-year, 10-year, 15-year data that patients have been using it for, and there's been no serious adverse effects or events of long-term use. It's extremely safe to continue using, and kind of goes back to the whole thing of it stays local. It does not get absorbed systemically. So over time, it's not going to irritate your stomach and your kidneys and your liver.
Do you typically see the efficacy start to decrease for people who are on it long term?
No, if anything, it seems to work better and better over time, which is very encouraging. And also when we combine it sometimes with other medications, we get a synergistic type of benefit too. So, if Botox is helping you 50%, let's see if we can get even better. We used to always aim for 50% improvement, but over the last couple of years, we've changed how we are doing some of our studies. Our goal is pain freedom, complete pain freedom. So that's really the new focus.
And you mentioned medications. Are there any medications or classes of medications that people should avoid when they're getting Botox?
No, thankfully not. No. So we do have some patients that are still taking their Topamax or their, Aimovig or Qulipta, some of these other migraine preventative therapies, and it's okay to continue. And sometimes bringing those together actually can help patients even more.
For listeners who have insurance, getting Botox approved and partially or fully covered is pretty common. But for someone listening who would be paying out of pocket, what can they expect to invest?
I would say completely out of pocket, patients could expect to pay $1,500 every 12 weeks. But almost every commercial Medicaid and Medicare insurance covers Botox. Now, however, you might have to meet some of their requirements, but for the most part, insurance is at least covering it. Now, what does covering mean? Is it 100% covered or is it 50% covered? So what's nice about AbbVie, who produces the Botox, is they have a Botox savings program for patients. So if you have a $200 copay, you can apply to their Botox savings program, and they will help patients with any out-of-pocket expenses that are not covered by your insurance company, and they will cover up to $4,000 per year. So majority of patients do not have to pay anything out of pocket for Botox.
And I will include a link to some information about that Botox savings program in the episode notes for listeners who want to check out that option.
Yes, please do.
Would you only administer Botox to somebody who is specifically having migraine? So for me, I have tension headaches, but was able to get the Botox approved. Regardless of what is approved by insurance, is it safe for people who don't technically qualify as migraine sufferers, but have other types of headaches at the same frequency that insurance requires? Is it safe for them to try this, or are you very strict about this has to be a migraine by definition?
So yes, I am very comfortable with trying it for other types of headaches. Insurance may not cover it. And so some patients are willing to pay out of pocket for it. So yes, I do feel comfortable. And I know a lot of my headache, providers throughout the country also feel comfortable with it. They're continuing to do more and more studies about even the frequency. Like, does somebody have to have 15 or more days a month? Like, can we maybe even go down to like 8 to 11 or, days per month? And the big push is like, we've got to catch these patients before they become chronic. And that's like a big passion of mine. I want to see you in my office when you're having 1 migraine a month or 4 migraines a month. I want to catch you then. I will see you, of course, once you get to 15, of course. But my goal is to hopefully catch you before you ever see that number per month. And I hope over the next decade, in particular with our new classes of medications and destigmatizing migraine and what it is, that we will hopefully catch these patients before they ever become chronic.
I think that's an amazing goal. Thank you so much for what you do and for all the ways that you help your patients. My last question would be, are there any success stories that just always sort of pop up in your mind, or a patient who just completely changed their life? Any stories that it just really are particularly gratifying to you or would offer a unique kind of hope to our listeners?
Yeah. I would say a couple of my patients I immediately think of is teenagers in high school, barely getting through high school, having horrible headaches and migraines, sensitivity to light, sound, nausea. The parents were just desperate for them just to get through school, And so, we'd obviously tried some other options, but we eventually got to Botox for chronic migraines. And these patients are doing amazing. They've graduated college. One's living in DC, hopefully going to be the next politician. She's amazing. Another patient, I don't even see her anymore because her migraines after college have basically disappeared. I mean, she just doesn't have headaches and migraines. And so to see these two teenage girls go from severe debilitated headaches and migraines, their parents weren't sure if they were going to get through high school, to graduating college and having amazing success stories, just being able to live their life again it really comes straight to me. It's just like amazing. We just really need to educate patients that there's actually headache providers. I mean, it's fascinating that I will run into somebody and they'll ask what I do. I'm a headache provider, and they're like, oh, well, I get headaches, or, oh, my wife has headaches, or my friend. And I didn't even know there was a headache clinic. And headaches and migraines are the second most debilitating condition. And so the fact that people don't know that there's actually headache providers is really sad. So I think we need to get out there and educate more and explain to patients that, yes, there's some over-the-counter medications that do work great for some patients, but if you do start to find yourself taking them more and more and more, this is a red flag. You need to be properly treated and evaluated by a headache provider. Unfortunately, some of the primary care doctors don't have time, or they don't ask. So really, truly seeking out a provider who has a passion and treats patients with headaches and migraines will definitely get you the best care, for sure.
Yeah, it's all about self-advocacy here, because if you're not looking out for yourself, nobody else is going to be going out of their way to look out for you.
Yeah, that's so true. You do. I tell patients that all the time. You have to be your own advocate.
Brooke, thank you so much for sharing your wisdom with us. It's been a really nice conversation, and I hope a really valuable one for our listeners. So thank you so much, and best of luck to you.
Thank you. Take care.
What do you think about Botox injections? Are you turned off by the idea of multiple needles being inserted into your face and scalp? What if it was the thing that truly restored your quality of life? Would you elect to have it every 12 weeks? I can tell you confidently that if Botox was the thing that cured my headaches, I'd absolutely continue with it. But again, just because it's not my magical unicorn doesn't mean it couldn't be yours, or that it couldn't change the life of someone you know. Please let me know your thoughts about Botox in a short review of this episode on Apple Podcasts. And please text this episode to someone you know who, like you and me, deals with pain on a daily basis. In our next episode, we'll be exploring acupuncture and how it can be used to help those of us with chronic headaches and migraines. And I'll share my experience trying acupuncture many times over the years. Thank you to Brooke Phenicie for sharing her knowledge and experience with us. Thanks to GammaCore Non-Invasive Vagus Nerve Stimulator for sponsoring this season of the podcast. And thank you for joining me on this headache journey.